So we have 4 nurses who are creating their own practices, contracting them with us, and then collaborating with our clinical team in the care of patients. Have hypertension or diabetes or congestive heart failure. So in my model, we center behavioral health, but we complement it with geriatric medicine as well. We believe that only 5% of the nursing workforce can completely transform the cost of Medicare.
Hello, everyone. Welcome to one more episode of Unlocking the AI Advantage podcast. This is your host, Ramesh Danta. And today I'm pretty excited to introduce a guest that I met recently at a conference. And his name is Joe Harrison, and he's in charge of a company called Avail Health. So we will get to know more about Joe and Avail Health in a second. So with that, hey, Joe, welcome to the podcast.
Thank you so much, Ramesh. I really appreciate the invitation.
Great. So I'm glad I met you at the Innovation Challenge there. And so I was intrigued by what you guys are doing in the healthcare space. So first, why don't you go ahead and introduce yourself and your company, please?
Okay. Yes, thank you. My name is Joseph Harrison. I'm actually a geriatric psychiatric nurse practitioner. So my background is as a clinician. But in both in my family and my own life background, I also have entrepreneurial experiences. And so I started Avail Health in January of this year. So we're a very young company. So we're a tech-enabled care delivery startup. We're currently raising money from investors so we can scale what we're building. And what Avail Health is, for the folks who are really familiar with the healthcare startup space, they'll recognize that we are what's called a management services organization friendly professional corporation model. So we are an entity that is an investable and buyable or sellable company that partners with a professional medical corporation in each state that we operate. And what we do is we take care of folks who have dementia or other mental illnesses who are also Medicare recipients.
I see.
Okay, so Medicare, traditional Medicare, and then also Medicare Advantage health plans, and then also accountable care organizations. Now, something that's unique about us is because of my clinical background, I didn't want to just focus on the psychiatric or neuropsychiatric specialty. I've been working for 13 years serving patients in both Medicare Advantage and traditional Medicare. And I knew that any model that's really going to take really good care of older adults who have either new mental health needs or cognitive changes happening, they also have a lot of medical needs, right? They're not just experiencing dementia or mental illness. They maybe have hypertension or diabetes or congestive heart failure. So in my model, we center behavioral health, but we complement it with geriatric medicine as well. And then the other part I think it's important to explain is most of the history of healthcare around caring for aging adults has been focused on what we call encounter and management practice. So it's, when you go to your doctor's office and you're seen, and then very little happens until the next time you're seen. And whatever you need to do for your health in between those visits, it's really up to you and your family, right? Well, there are new billable codes in Medicare and a movement, a realization that there's a lot more we can do for folks who are aging. And so there's this model of what we call care management. And that's where you have, in our model, a registered nurse who understands the patient's diagnoses, their medication list, their home environment, their family system, and does navigation through the healthcare system to get their needs met, does education to them and their loved ones about their disease, about their treatment plan, and really is this sort of partner down a journey that is actually having more touches and more contact with the patient than the person in my role, the geriatric psychiatric provider, because I might see them, in the beginning, I might see them 6 or 8 times in a year, but
Yeah.
once I know the patient, I might only see them 4 to 6 times in a year, and they're going to touch base with them on a monthly basis. And why is that important? Because it reduces the risk of bad outcomes. It keeps patients more stable, able to live in their home for a lot longer. It helps ameliorate the challenge and pressure and stress that their loved ones are experiencing as they go through changes. And so it's really a much more holistic model, and it produces better outcomes. And for that reason, CMS, the organization that manages Medicare, and also the Medicare Advantage health plans increasingly are paying for this because they know that it actually has a really good return on investment.
Correct. And then basically, you're focusing on the wellness of the patient in a comprehensive manner. So, a couple of things that going through my mind while you're explaining, what Avail Health does. By the way, that was a great introduction. So, first thing is you started off, it's a tech enabled. So, can you talk a little bit about what aspects of your care delivery is tech enabled?
Yes. So, nowadays everybody's very familiar with what we call digital healthcare or virtual care,
Yeah.
right? Where you're seeing a person, a provider, a clinician through your computer or through your smart device.
Okay.
So that's not new. But something that's relatively new and largely has grown during the pandemic is having secure private ways of communicating with your care team at any time, day or night, that
I
is
see.
secure, that where your information is protected, where you can ask questions and then get them answered whenever you need to ask the question, and they'll be answered in a timely manner. So think of it as like, the using SMS text messaging technology to actually take better care of folks and make it easier to get your questions answered. So that's one part of it.
Yeah.
But there's other parts too. For example, we can now, in a remote location, take care of hundreds of patients in a way we couldn't do before. For example, if I have a patient who's living in a memory care setting, and people with dementia, just so you know, are at increasing risk of falls. So
Hmm.
I'm not just thinking about their mood and their sleep and their memory. I'm thinking about their general safety and well-being. We have technology resources and partnerships where we can monitor them and look for risk factors that we can actually ameliorate to decrease the risk of their falls. And I may never actually be in that setting, but I have a full line of sight of what's going on in that environment. So that's another technology piece. But one that I'm most excited about, thinking about taking care of providers and clinicians, because that's something we have to do. There's a huge crisis of clinician burnout.
Hmm.
And one of the most high leverage things, I mean, as a clinician myself, is using, for example, what we call ambient AI technology. So while I'm having a visit with a patient, that visit is being recorded or basically processed, transcribed by an AI tool. And it is trained to do this for clinical visits. And basically, 80% of the time I might spend documenting a note, I
Yeah.
don't have to. And what does that do? It takes the burden off me, but it also allows me to focus more on my patient and stay looking at them and listening to them and not multitasking, right? So that's a really powerful technology we're using. And then one other I'd love to mention is that AI has also gotten better at interpretation. And my whole clinical practice, I've been practicing in the state of California, and I have on any given day see people who speak up to 6 to 8 languages,
I see.
right? And so what AI can do for me is enable me to listen to the person speak their preferred language. AI tells me what they said, and then I speak to them in English and tells them in their preferred language what I said. And so it empowers the individual patient to not have to rely on a family member, or for us to not rely on undependable live interpretation services that are phenomenally expensive and also delay clinical schedules and make patients wait. And so it's a really fantastic, powerful technology solution to something that actually if you speak a second language, you have many more risks of bad outcomes in health. Okay. And so, sorry, if you speak if you're a non-English speaker. So
Yeah.
this actually helps to close the gaps in outcomes.
Yep. Actually, it's a great example that you gave, Joe. I mean, if I understand what you're saying is you're using technology to facilitate the healthcare practice, to the clinicians and practitioners. So that is where a lot of your effort is going into making sure the technology is, beneficial, because these guys are practitioners and clinicians. Their focus is on delivering care, not so much in the technology. But Avail Health, you want to make it easy for them to use the technology to deliver the care.
That's right. And so, so there's the patient experience and then there's the clinician
Clinical
experience.
experience.
And some of these technologies improve both at the same time, right?
Yeah,
Like the examples I gave you.
yeah,
And some of them just improve the clinician experience. For
correct.
example, some people may be familiar with single sign-on. That's
Hmm.
where, you have a technology solution. If you're using different applications, you only have to log in once to get access to multiple different applications.
Yep,
In the clinical care delivery side, the electronic medical record system, right? That's one. But then you also have things like remote patient monitoring dashboards, care management modules, or mobile care delivery technology, the AI ambient scribe technology, the interpretation technology. We're deploying a model where our clinician just doesn't have to log in and log in and log in and log in, right? That doesn't really affect the patient experience so much directly, but it helps to prevent burnout. It helps clinicians to feel like it's easy to do their job.
yeah. No, honestly, Joe, that is a really good point. When we talk about technology, we talk about, futuristic, something robotics, but the operational specific areas where there is a lot of opportunity to, use technology to make it easy, like a single sign on, right? So single sign on, for people who know technology, who like somebody who's been there, it's been there forever, and then it's understood very clearly. But for lots of practices like healthcare, it is still very early stage. Oh wow, I have a single sign on, I sign in once, I have access to labs, I have access to patient records, I have access to images, all of that in one. So makes my life very easy.
Yeah, I mean, I think we have to focus as a leader in healthcare. I have to think about that. That's where empathy, like the power of empathy, right? Like it helps me to be a clinician because I actually have felt that pain. And so I know what it feels like and I want to fix it for myself. So I'm going to try and fix it for someone else. But I really appreciate your point. There's a lag, right? There's a technological lag in healthcare. So what something that has been in existence for could be for a decade is still not implemented in many healthcare settings. I mean,
Correct.
you know that faxing is still the predominant mode of
I know that.
transferring data.
I
I
know
mean,
that.
it's absurd because it actually slows communication down. It makes it harder to find the information you need. It costs the system money because it's a human threaded process rather
Yeah,
than a technology threaded process, right? And
yeah,
so now there's a phenomenon in the healthcare space, partly because of regulatory and legislative changes, and
yeah,
partly because of technology advancements, where we have what's called health information exchanges. Now, at the single sign-on process, when I'm in my electronic medical record system, I can access a database that I can ping for using the demographics of my patient, and I can literally get access to, I mean, we're talking about like 80 to 90% of Medicare patients,
yeah,
okay, their entire health history, right? So I don't need to be making patients sign a release of information and then faxing that to their doctor and then making the doctor's staff have to
yeah,
send me the papers. I literally just log in, put in the demographics, and at my fingertips is their recent medications, any recent emergency room visits or hospitalizations, all their existing diagnoses, who are their current providers, all at my fingertips. And that is a true technological advancement. Now that technology has existed for a long time, but the regulatory and sort of operational environment now supports it.
Joe, if you could solve that problem, I think you're probably sitting on a gold mine here. Hey, so let's go a little bit, in a different ways to understand what is the business model of Avail Health. How do you get paid?
So I didn't say this at the beginning because I didn't want to confuse the matter. But our model, we're not employing registered nurses and nurse practitioners. We're actually, because we're a management services organization, we're creating private practices for them. We're managing the private practice for them. We're delivering them the patients and the insurance company or payer contracts. And we're putting it all into a single package so that they can own their own practice, work the hours they want to work, take care of the kind of patients they want to take. We call it in healthcare, clinical autonomy, right?
Okay.
They're actually picking and choosing and having more say over the conditions of their profession. Now, so our model is that we get revenue coming into our business from the insurance companies like a Medicare Advantage health plans or accountable care organizations or traditional Medicare and Medicaid.
Yeah.
But there are a few other types of funding sources for us. For example, senior living communities, long-term care insurance companies, and even private pay from individuals who want services that might not be covered by their health plan. Okay, so we have a versatility in our revenue model. And it's all for clinical care, right? We're getting paid for clinical care. But on the other side of our business, the
Yeah.
nurses and nurse practitioners are paying us to create and manage and grow their practice. So we're actually getting paid on the clinical side and we're getting paid on the management side. And for me, the reason I'm doing that is because I wanted to own my own practice and I created it, and it was very painful. I had to learn many, many things, and I had to jump through many hoops and overcome many hurdles. But once I'd done it, and then in the healthcare startup world that I've been in for the last 3.5 years, I did it a couple more times. I realized, oh, now I know how to do this. This is an amazing value I can add to other clinicians' lives, to stand up a model that does that hard part for them so they can deliver excellent care to patients and focus on clinical care.
Got it. So, but many of these nurse practitioners, they have to be independent kind of a nurse practitioners for them to be working with you, because many times I see nurse practitioners are working in a medical facility and along with the doctors and all that stuff. So, how does it work in that model?
I can tell you're a very sophisticated healthcare interviewer, because that is a hugely important point. So about 30 something states in the United States allow nurse practitioners to practice independently.
Okay.
The rest of the states, they don't allow it. And so, and then for registered nurses, they are not able to practice independently and hang their own shingle and impanel their own patients. So in
I
our
see.
model, because California is not, this is our first state, not not one of the states that allows full practice authority or independent practice, we have a medical group. And so when we create a private practice nursing practice for an RN or an NP, they're contracting with the medical group. The patients that we're taking on and providing psychiatric care and medical care and care management services for are actually technically impaneled to the medical group.
Right.
And so it gives us what we call the regulatory capture, right? And then if we have physicians in our team, we have collaborating physicians, right? We have an executive medical director. We have licensed clinical social workers. We have physicians associates or assistants. So we have a multi-professional, multi-specialty team. But in our model, the only private practice owners are the RNs and the NPs. Now, maybe in a future state, we'll do that for the LCSWs and we'll do that for the PAs, but we're focusing on redeploying nurses into the community to keep people from the hospital rather than saving them when they get there, right?
Got it.
We want nurses to be in the hospital, but we believe that only 5% of the nursing workforce can completely transform the cost of Medicare. I mean, to lower the cost by 20 to 30% of the entire system. And this is the vehicle by which we can do that.
Fantastic, man. So this is good. So I know it's an early stage. So hopefully, so we'll make a lot more traction with this one. So now, Joe, let me. I think I have a good idea of what's happening with Avail Health and how the business is working. But let me talk a little bit about Joe Harrison, the individual who decided to do something like Avail Health. Okay, you're a clinician. You practice for 13 years, and then at some point you said, I don't want to do it, I really want to do Avail Health. So talk to me about what made you do that.
Yeah, I think that's for me. I told you I'm fundraising, right? So I'm talking to investors, and one of the things that I say to all investors is really Avail Health is woven together from four distinct threads of my experience. The
Okay.
first thread is I'm a nurse myself, right? All nurse practitioners are registered nurses first, right? So I know the power of registered nurses, and I know that we have an opportunity cost we're paying as a society to not have more of them in the community. Okay. Secondly, I'm a behavioral health specialist, geriatric psychiatric specialist, and
Yeah.
this is a huge shortage area, and something that your heart would break if you knew how many seniors and their loved ones spend inordinate amounts of time trying to find mental health or cognitive care, right? And so for me, I'm very compelled to try to close that gap, and it's an area of expertise, so I feel very confident I can help in that way. The third thread is that I left regular W-2 job 4 years ago to become a clinician entrepreneur. And so when I'm building Avail Health, I'm not just being entrepreneurial myself. I'm actually building a model to allow entrepreneurism among nurses and nurse
Nurses,
practitioners,
exactly.
right? And then the fourth thread is that the first 10 years of my practice, I was very lucky that my first job was in what's called a Medicare Advantage health plan. I worked for the insurance company with teams of clinicians spending more money on the outpatient side to keep people well to prevent hospitalizations. And we
Correct.
did a fantastic job at it. It really works. And so for me, I'm weaving all those four things together. Now, I'm not making an insurance company, but I'm making a company that serves insurance companies by serving their members very well, the patients.
Hmm. So Joe, so, I mean, there are four good threats, by the way. So you really thought through all of that. But the challenge of for anybody to go from a W-2, which is a salary kind of a thing, and where unpredictable income streams for your own is not easy. Okay, so right. So and then 4 years ago, you've decided to do that, and then the Whale Health came into being as an entity beginning of this year. As you're still raising money and all that stuff, but what has that journey been? How have you been taking care of yourself while you're building Avail Health?
Yeah, that I love that question too, Ramesh. Well, first of all, I mean, everybody who does advanced training as a clinician most everybody ends up in debt, right? So the first 7 years of my practice, I was paying a virtual mortgage every month of debt off. And I finished paying it off after 7 years.
Okay.
And then I immediately focused on saving very aggressively. So I wasn't denying myself anything,
Yeah.
but I was not spending money willy nilly. I was being thoughtful. So I
Nice.
saved a lot. I saved a lot of money. My first company, about 3.5 years ago, I bootstrapped it myself. I funded it myself,
I see.
and then I sold it. And then I entered another company where I was a W-2. So I had a salary and benefits. It was a startup though. It was creating something new.
Mhm.
And then I left that company and I entered another company. And again, I had a salary and benefits. So there's been twists and turns and ups and downs, but generally I've had a consistent income except for a this last period of about 7 months, and then a period of about 4 months. Mostly I've had a healthy income that's been consistent. But I would not have been able to do Avail Health if I had not saved, because I have foregone income and invested significant amounts of money into this business. And I'm happy to do it. And I'm very lucky that my spouse believes in me. But there are limits, right? And that's why I am raising money. I
Yeah.
wanted to get the company to a place where we did what we call de-risked the investment, right? So investors feel more confident that this can be successful, and that's where we are now. We have multiple contracts, very healthy funnels of patients. What we need now is to hire more clinical staff because we've got so much opportunity. We've had to stop business development because we don't want to get contracts we can't execute.
Yeah. Yeah. Hey, great. I think lots of things came out of that particular discussion. One is that, hey, you have to de-risk yourself some way, right? If you're an entrepreneur, if you want to be an entrepreneur, the message that you're conveying, and then I could also share similar experience. You have to de-risk some way, and then the way you de-risk is by saving aggressively in the beginning, so you take care of yourself. That's one. And number two, it came very quickly, but you did mention your spouse has to believe in your dream vision. That is very important for everybody. There has to be it takes a village to make these kinds of happen, so you need people who support you and all this kind of stuff. That's the second point that you brought up. That's excellent. And then third one is hey, definitely you're wanting to raise money, so to scale it, right? So it's where it is, it's not sufficient, and for you to go to the next stage you have to do it. And then this is where you really at some point you have to let go of bootstrapping an enterprise than actually going and seeking money. And this is the time for you on Avail Health. That's what you said. So lots of things came out of the discussion. So great points that you made, Joe. So on that one, so what's the future looking out for you? So we talked about you wanting to raise money. That's one of your main things. And what are the areas that you're working on? What's in for you, and then Avail Health?
Well, yeah, thank you. Thank you for that question. So we just went live with care delivery 3 weeks ago. So
Okay.
we call it in the healthcare startup world 0 to 1. You start from an idea and you get to now you have revenue, right?
Yeah.
And so we've got there actually pretty quickly, compared to other bootstrapped companies. But so we have patients, we're adding patients, we're taking care of patients. We're also piloting our private registered nursing practice model. So we have 4 nurses who are creating their own practices, contracting them with us, and then collaborating with our clinical team in the care of patients. So
Very
that's
nice.
so that's what we're doing right now. And then I'm very proud to say we're accepted by CMS as what's called a CMS guide model participant. The guide model is an 8-year pilot focused on taking better care of people with dementia, Medicare recipients with dementia. And so there's a very complex sort of a list of different services and supports
Yeah.
that are being offered. And so we go live with that model in July of 2025. So we are building what we call our guide model product right now, while we're taking care of patients with dementia and geriatric mental illness. Already we're building a product that fits very, very nicely inside the guide model, so that when we get that permission on July 1st, 2025, we're ready to take on and onboard hundreds of patients in the preceding months.
Excellent. Hey, Joe, it's great discussion. Actually, I mean, what I really liked about the discussion is that you are able to articulate how you're building a business, starting from your own expertise, but you did not just focus only to your expertise, right? So you became an entrepreneur, but you wanted to other practitioners in your area also become an entrepreneur, but you're connecting all of them together, right? So you're not just focusing on mental health, you're not focusing only on geriatric care, but you are trying to put together a comprehensive primary care, so enhanced primary care, I would say, so that people can stay at home longer, and then it's a lot more on wellness and that kind of stuff. And then so it's a lot of things have come together for me, and I hope the audience also will get to get that kind of feeling and experience from this conversation. So I really appreciate your time, Joe. So thank you very much for recording with us.
Oh no, thank you so much. And I agree with every like the whole way you summarize that. I think you're that's spot on. And I will say, sometimes trying to solve multiple big problems at the same time is not the best fundraising strategy, right? Because investors are a little bit nervous about
Yeah,
taking on too much. They like to focus, but because of my clinical experience, I can't help it. Like I know that older adults need comprehensive services.
yeah,
We're not going to change things for these patients if we're
correct.
only giving them one thing. And so that's why I just do it, because I'm a clinician and because I want it to work for them. And so I'll dig the ditches to try to persuade the investors, because the end goal is so worth it for me. So
Got it.
thank you so much for giving me a chance to talk about Avail Health, and I really appreciate it.
Thank you very much, Joe. Take care.